Hello everyone, I am Dr. Rohit Ranade. I am a senior consultant and clinical lead for Gynaecologic Oncology, robotic surgery and peritoneal surface oncology at the Narayana Health City in Bangalore. Today we will discuss about recurrent ovarian cancers. Now as you know, ovarian cancer or the cancer of the ovaries is one of the commonest cancers to affect women in their lifetime. Now most of these patients unfortunately present to us in advanced stages, that is either in stage 3 or stage 4. The main treatment options for these patients are a combination of surgery and chemotherapy. Now, unfortunately, even after all the treatment, some of these patients have a recurrence, that is, the cancer comes back. Now, in these patients, in certain selected group of patients, we still can treat them with a curative intent. Curative intent is where we intend to treat or to cure them. Now, in this, there is a specialized surgery which is known as a secondary cytoreductive surgery. Now, this surgery means that this is in carefully selected patients, we go and remove the disease where the tumor has recurred and then give chemotherapy either during surgery, which is called as HIPEC, that is hyperthermic intraperitoneal chemotherapy, or an intraperitoneal chemotherapy or an IV chemotherapy. Now, previously we were doing all these surgeries by an open surgery, that is you had to take a big cut on the abdomen and we had to do the surgery. All of this meant that the patient had a lot of pain. They could not be started on feeding early after surgery, that is you had to fast them for 1 or 2 days after surgery. There was a lot of blood loss during surgery. All of this meant that overall recovery used to be prolonged from 2 to 3 weeks, and all of that meant that the quality of life was not very great. But now there is good evidence to suggest that we can offer these patients surgery by minimal access surgery. Minimal access surgery, or also known as keyhole surgery, using the robotic technology. Because of that, what happens is, instead of doing a full cut on the abdomen, we do surgery through small holes, that is 8 millimeter holes in your abdomen, and through the entire thing the surgery is done. Now these are potentially very complex surgeries, because whenever the patient has undergone a previous surgery and has a recurrence, the tumor is going to be stuck to all vital organs like the intestine, like the blood vessels, like the urinary bladder. So the use of robotic technology gives us a much better articulation because of the superior instrument dynamics. It helps us to carefully separate the tumor and save the surrounding structures and thus perform surgery in a seamless way. Recently we have introduced these facilities at the Narayana Health City, and we have treated a few number of patients with these new technique, and the initial results are very encouraging, and we are able to offer the same quality of surgery what we were doing when we were doing surgery by the open surgery. So that is why it is very important that carefully selected patients should be offered this secondary cytoreductive surgery using a minimal access surgery, mainly the robotic surgery, or in some cases laparoscopic surgery can also be offered. Thank you very much.